Doctor, don't join us. We'll talk to her now. Dr. Hilda Affairs, she did online. Hello, Dr. Hilda, you did here?
Yes, good day.
Good day, Dr. Hilda. You're welcome. Good morning. Good morning. Good to say you don't finally join us on top of this matter. Make we not to waste time because of time. We'll just enter the thing straight. This Alzheimer's, where the thing be? If you just tell us what thing this thing be about, make people where they watch us understand them sharply.
Okay. Thank you for inviting me, first of all. It's good to be here once again.
Okay.
Alzheimer's disease, in simple definition, it's a neurodegenerative disorder marked by cognitive and behavioral impairment. This can significantly interfere with one's social and occupational functioning. And this condition happens to be an incurable disease with long preclinical stage. When I say preclinical, I mean in this stage, right, it won't show any symptoms for a very long time. And then it will now be very, very progressive in nature. This occurs when things called plaques, they develop around the hippocampus area. It's the structure in the brain that helps encode memories. It can also affect other areas in what they call cerebral cortex. And this cerebral cortex, they help in making decisions and critical thinking. It can lead to dementia. Dementia in this case is termed of memory loss, having issues with language, solving problems, and having the ability to do some basic motor skills. Now, I'll explain this Alzheimer's disease because it has different stages. There are 3 stages that we classify it into. Basically, the preclinical Alzheimer's disease, the moderate Alzheimer's disease, and the severe. In this preclinical Alzheimer's disease, like I earlier mentioned, patients will not show any symptoms. They can go on for years and decades, not knowing that anything is going on. But meanwhile, in the brain, specific regions, such as hippocampus, like I mentioned before, and also something called the entorhinal cortex, right? This is located around the medial temporal lobe of the brain. Here begins to accumulate plaques, and it will destabilize the activity of the brain over time. This then leads it into the moderate Alzheimer's disease, where people begin to present with symptoms.
Okay.
Are you with me?
Yes, we're with you. Carry on.
Okay. So in this stage, right, you now see when elderly ones will now begin to present with increase in memory loss. They won't have like as good of an attention span. They'll have problems organizing friends and family, difficulty reading and writing, organizing their thoughts. They won't get very anxious, and they will start having repetitive talks. Like if you tell them, okay, good morning, they tell you good morning, they can pass again and tell you good morning again. Do you understand? They can start hallucinating and having illusions, and they'll just be acting very impulsively. That's why sometimes they say, oh, some elderly people, they behave childishly, but it's really not their fault. They may be going through Alzheimer's disease. Now, in this severe stage, right, which is a very bad stage, where patients cannot recognize their family or loved ones at all. They cannot even communicate very well. They become totally dependent on others for care, and this is where a lot of elders, they might experience abuse, because if they're not with the right people taking care of them, those people then begin to abuse them. So elderly abuse is really a thing to raise awareness for. Yeah, they now become very sick. They can experience weight loss, seizures, skin infection. They start sleeping more, going into depression. And this condition does not directly cause death, but it can lead, when patients become bedridden, it can lead to something called aspiration pneumonia. So we're wondering the cause. Well, the cause, right, in this case, right, there's no definite cause for this, right, because it's unknown at the moment. But there are risk factors such as advance in age, family history, genetics. That's the APOE4 genotype.
The what genotype, please?
Like it's a type of genetic mutation. That's what I'm trying to explain. Genetic mutation. So that may happen in individuals. It has to do with genes. That this is something that one has to go check. Like for instance, the autosomal dominant Alzheimer's disease mutation genes, right? They are mostly responsible, which is the amyloid precursor protein gene on chromosome 21. There's the penicillin 1 gene on chromosome 14 and penicillin 2 gene on chromosome 1. So these are genetic factors that occur and may predispose one to having an increased probability of having this Alzheimer's disease.
Okay. So doctor, in all of these causes when you just named now, will be done they hear themselves don't talk and say some people when they get an maybe prolonged hypertension when people don't get hypertension case before or history of hypertension, or people will be say don't go through a lot of prolonged emotional issues for a long time, many years. Say if you also lead to dementia later on. Not true. I've been a myth.
Yes, it's true. Long-standing hypertension can lead to this condition. Even insulin resistance, in case we have for diabetes, can cause this. Vascular factors, even Down syndrome, traumatic brain injuries can also cause this. So there are different ranging of causative factors for this. Even obesity can cause this. You understand? But the most common one is really in advancing age. When someone may have a genetic disposition to having this condition. And one way you can diagnose this, right, it's only when it gets to the clinical, let's say the mild stage, the mild to moderate stage, right? That's when you can find it on examination. You can also do a lumbar puncture. You see increase in levels of the tau protein, phosphorylated tau protein under your CSF. You can do your MR and CT to rule out causes such as chronic subdural hematoma, which could lead to this Alzheimer's disease in the future. So in terms of management, really, there's no cure for this. It can only be managed by some medications that they developed over time, such as the cholinesterase inhibitors, that's CHE1, and other N-methyl D-aspartate antagonists. And then they now manage the psychiatric symptoms with some antidepressants, beta blockers, anti-epileptic drugs, you know. It's more of something that you just manage the symptoms around. There's no definite cure. And in this case, right, prevention is mostly by just living a healthy lifestyle.
Just living a healthy life.
Diet, exercise, just doing what you can to live a healthy lifestyle. And studies have shown that having a Mediterranean type of diet helps improve this condition. It's just studies, but it's not something that's so definite.
Okay, so could they chop more of vegetables and fruits?
Yeah, just a healthy lifestyle.
Okay.
All right.
Okay, Doctor, time,
yes,
no door. Let's let you to the talk, because everything where they talk here makes sense. And people don't be very educated concerning this matter. And when I don't hear everything where doctor talks, say the sickness, it gets to do with the brain. I mean, they call it neuro something.
Neurodegenerative disorder.
Exactly. And she don't talk and say, get cure. So when you get elderly person, when you be say, they remember things the way they remember before, no, they behave the way they behaved before and all of that. No blame them, no be their fault.